No, I sit better here.
Okay, we're ready.
We're good?
We're live.
It's better.
All right, let's call the meeting to order. All rise for the Pledge of Allegiance. I pledge allegiance to the flag of the
United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, roll call, please.
Mr. Boba,
Here.
Mrs. Cerrucci,
Here.
Mrs. Delaney,
Here.
Mrs. McBride, Ms. Mungo. Here. Dr. Singh.
Here.
Mr. Ritter
Here.
and Mrs. Horning.
Here.
Thank you, Bonnie. First of all, thanks everyone for coming out this early hour. Got a lot of work to do. We're going to get it done real quick if we can. Do we have any comments? In fact, we had 4 people call in looking for the opportunity to speak on agenda items. Did anyone else sign up? Thank you, ma'am. Let's start with number 1 on our list. Number 1 on the hit parade, Cheryl Boys, vacant board seat.
Cheryl Boyce from Monroeville. I'm assuming and I'm hoping when we do fill this vacancy that you're going to use the election as the criteria for this. I've done a lot of research. There's nothing prohibiting you from doing that, given the circumstances. This is really very strange. We never have had this happen before. I tried to look it up. So I'm hoping that's the criteria you use. If that's indeed the case, because I think the public has a right to have some input, because we've had an awful lot of vacancies where we didn't have say in this. But the one thing I do want to get clarification on from Mr. Dice, it says in the resolution or on the agenda that it's a 2-year term. Is that correct? Even though it would have been 4 if Mr. LeMayo was able to serve, it's only 2.
That's correct. The
And-
vacancies to the next municipal election, which is 2 years.
Okay, is that always true of any kind of, anything that's out of the norm?
When there's a vacant, yes. To answer your question very specifically, yes.
Yes, okay, so there is nothing to,
The charter in Monroeville, it's every year.
okay,
That's because the charter does that.
but
Boroughs
that's,
and school districts do exactly what we're doing tonight. Boroughs, townships. schools.
it's the next municipal election. All right, so that clarifies that. So I am hoping you use that as a criteria to determine who gets this. I know there were 2 people that did not make it onto the board, clearly. I mean, the person after Dr. Singh was Dr. DiLorenzo, who unfortunately can't be here tonight due to a funeral. But I always look at people's resumes. I think we need to do more of that. I think we don't do enough of that in Monroeville. We used to do a lot of that with school boards. So it's to your discretion how you want to handle it. But it makes sense that the public has a right to have input. That's the election. It happens so soon. And also to look at the resumes of the individuals. I think the 2 people that didn't get on the board, both are wonderful people. I'm just going by who was next in line. And that to me is only fair. So if you don't do that, I think what I'd like to see happen is the board explain your thinking as to whatever you decide to do, whatever your thoughts are. Because I think the public sometimes doesn't understand where you're coming from. So I think on this particular item, it might be good if you explain based on what you do, your thought process, if you can do that. Okay, thank you.
Thank you, Cheryl. Because of the nature of this meeting, I'm not sure we have the ability for everyone to explain how they come to their conclusion. I think that based on the nominations you hear, you will be able to deduce who agrees with you in terms of paying attention to the election and who believes we should open it up to the audience. It's going to be self-explanatory. And I don't even think at that point there's much debate. You know, one group thinks opening it up because the law doesn't specifically tell us what to do. Another group thinks honor the election. You'll know who's who in a matter of minutes. Thank you. Len Young, Monroeville? Is Len here? No. Let's move on to Brittany Delancey. No? How about Jeanette Beagle?
Jeanette Beagle, Monroeville resident. I wanted to speak on both items. So first pertaining to the vacated seat. I see reasoning on both sides and I see good argument on both sides. We did just have the election, but again, in 2 years, there will be a special election where the people yet again get to have a vote. Honestly, I believe you should open it up as you have done the past. I don't know, what is this, 4 or 5 seats now we filled in the past couple years. It's becoming almost a yearly, quarterly thing here. But I think letting people put their resumes in and having the open discussion is a better way to go, because in 2 years you do have that special election. The other item I wanted to comment on is the health and safety plan. I personally am not okay with saying no masks January 10th. The elementary age students have just recently gotten the ability to get shots. People are still waiting 2, 3, and 4 weeks to even get their first vaccine. From first vaccine to being considered fully vaccinated is a 5-week period. There are people that are still waiting to get their first shot. Some of them waited to do that over the holiday break because they want to see if there's any side effects from the shots. At least give it to the beginning of February. I understand masks are not going to be a thing the whole time, but please do that. My son contracted COVID, and we're pretty sure it was at Moss Side Middle School that he contracted it. Sunday night, he was admitted to Children's Hospital with a blood clot in his lung as a byproduct of COVID. 6 to 12 months after a COVID diagnosis, you are hypercoagulable. They have run blood test upon blood test. There is no underlying coagulation issues with him. Every month now, he will see a hematologist, a pulmonologist, a cardiologist, and an infectious disease doctor. Every one of those doctors stood in my son's room and said, yes, you are fully vaccinated, but you need to continue to wear that mask, whether your school says yes or no. That is your only defense left that you have, and not enough are vaccinated to say it's safe to take them away. So please take that under advisement, that you are exposing a lot of young children to health issues that they shouldn't even be having. Parents should not be discussing whether we're doing Lovenox injections, whether we're giving Eliquis to our children to thin their blood, whether they now have to sleep with oxygen at night because they're not getting the proper oxygenation. This is my life right now because of a COVID exposure in the middle school. No other health conditions. So please take that under advisement. At the very least, give the parents that want to vaccinate their kids the time to get them to fully vaccinated status. That 5 weeks is important. Thank you.
Thank you, Jeanette. And, my sympathies for your son. I know it's a secular entity, but my prayers will be with your family. And thank you. Was that Brittany that just came in? No.
Okay, sorry.
All right. We also have Dan Gerhart, Monroeville.
Dan Gerhart, Monroeville resident. And I also agree with Jeanette. I can see both sides of the open board seat as we're opening up or leaving it to the election results. And to be honest with you, I'm fine either way. Doesn't matter to me. But I would ask that if you do decide to open it up, that since would consider Scotty Williams as a candidate for the past 20 plus years. Scotty has been a pillar in this school district. And I have to say, he's probably one of the only ones I've known on a school board who has had zero personal agenda. His only agenda has always been for the children of Gateway and Pitcairn, all the time, no matter what. I've actually just had an incident where I had something going on over at Forbes Trail. I called Scotty. I said, Scotty, this is what's going on. Can you find out answers for me? Not 5 minutes later, I got a phone call back from him. and the problem was resolved. That's unheard of in school districts. And this gentleman has always been here for our kids, no matter what. And sometimes I yell at him because I don't think he speaks up enough. But that's his nature. He's a quiet guy that likes to do things behind the scene and get results. He's results oriented. And like I've said, I have yet to ever meet a school board member who's dedicated as Scotty. Thank you.
Thank you, Mr. Gerhart. And I think that does it for our comments. So we're going to move on to section F in the administrative agenda. Section F, number 1 is declaration of school board vacancy. Yep. Whereas a vacancy exists due to a newly elected board member not taking the oath of office as school director, and whereas the school director's desire to fill said vacancy from the date of this resolution until the first Monday in December 2023 following the municipal election. Now, therefore, be it resolved, a vacancy has been created in the office of the Gateway School Board by virtue of James Lomeo not being seated in his office in accordance with the Pennsylvania School Code. I am now seeking a motion to approve that resolution.
So moved.
Second.
That motion has been made and seconded.
Roll call.
Could I have a roll call, please?
Mrs. Cerucci.
Aye.
Mrs. Delaney.
Aye.
Mrs. McBride.
Aye.
Ms. Mungo.
Aye.
Dr. Singh.
Aye.
Mr. Ritter.
Aye.
Mrs. Warning.
Aye.
And Mr. Bova.
Aye. And the ayes have it.
All right, so at this point now, a vacancy has been created under the Pennsylvania School Code. This board has 30 days from today, today's the 22nd, to fill that vacancy. It can be filled at any time.
But I would like to make a motion to appoint this evening Mr. Gary DiLorenzo based on the November election.
That motion has been made. Do I hear a second?
I second that motion.
That motion has been made and seconded. Do we have any questions? Mr. Dice, did you actually want to finish what you were saying? Or are we okay?
I don't know, you guys are going.
That's right. All right, ma'am, may I have a roll call vote?
Mrs. Delaney.
No.
Ms. Mungo.
No.
Ms. McBride.
Yes.
Dr. Singh.
No.
Mr. Ritter.
Aye.
Mrs. Warning.
No.
Mr. Bova.
Aye.
Mrs. Cerucci.
Aye. It's 4-4. Motion fails.
4-4.
Motion fails.
John, would you like to take over, John, at this moment? You want me to continue?
I'd like to make a motion to appoint Scott Williams.
We have a motion to
Second.
appoint. That motion's been seconded. Motion made and seconded to appoint Scott Williams. Do I hear any questions on that motion? Nope. Roll call, please, Bonnie.
Mrs. McBride.
Aye.
Ms. Mungo.
No.
Dr. Singh.
No.
Mr. Ritter.
Aye.
Mrs. Warning.
Aye.
Mr. Bova.
Aye.
Mrs. Cerucci.
Aye.
Mrs. Delaney. No. Motion carries for Mr. Williams.
That motion carries. Scotty Williams. Congratulations, you are once again a school board member.
Back in the saddle.
Can we swear Mr. Williams in so that he can participate in the next part of our?
Robin, maybe you want to come sit over here?
Oh, yeah.
Yes.
Please raise your right hand and repeat this oath after.
You know,
me.
there are
State
times
your
it's
name.
just-
I,
They're the people they're actually trying to help.
having been appointed to the office of school director, Gateway School District,
County of Allegheny. I solemnly swear that I will support the best and serve this position. And I will discharge the duties of my office in the county.
Okay. Harold? No, not a bit. Sorry, Robin.
That's okay.
Yeah, I was too.
Welcome back, Mr. Williams.
Thank you. You want to introduce because we're moving into section G right here.
That's fine.
Right.
Good. You ready? Scotty, welcome. Thank you
can I ask if
for your interest and welcome on board.
Bring that plaque back.
Very
we
good.
give Mr. Young a moment to speak? Because he
Mr.
did-
Young showed up, yes.
Oh,
Hi there. I'm Len Young, resident of Monroeville. First of all, I'd like to know, why did you have this meeting at 5 o'clock? Can you have it at 6?
there are a variety of reasons, Mr. Young, but that's what you want to know?
Start with one of them, please.
Because there's a concert coming on later tonight that many people wanted to see. We did not know how long the mask meeting would go because places like North Allegheny, it took 6 hours. So there was a number of reasons. Okay,
Some of us have to work till 5, it's hard to get here.
understood.
Mhm.
We're doing the best we can to juggle everybody's interests. Okay,
I understand.
thank you, sir.
Very good. We're going to move on to section G, Jack. Is that okay? Resolutions presented by board members. This one's resolved that the Gateway School Board of Directors approves.
We have number 3 in section F to complete reverse.
You want to read number 3 first?
So, okay, so number 3 first, it comes right before it. Updated school, Gateway School District Health and Safety Plan. Approve the updated Gateway School District Health and Safety Plan as depicted in Exhibit X.
Hey.
Exhibit A for the public to see.
We do have that. Are we able to put that up on the
You know what,
screen?
I actually don't have my computer with me.
I
If
have
Micah would have a copy of it, I do have a physical copy.
I can pull it up.
Yeah, Micah can pull it up. Yes.
Excuse me, Brittany Delaney is also here. Is there,
I can't hear you.
Brittany Delaney has also showed up.
Oh, well, while we're getting that set up, Brittany, you want to, what did she say?
She grabbing her information.
Oh,
Dr. Chakey. Micah pulls up the exhibit. If you're able to review that after we're finished here.
It is on board docs.
yes, ma'am.
My name is Brittany Delancey and I live on James Street in Monroeville. I would like to talk about the agenda items, including the health and safety plan and also the masking policy. I'm really angry that Leslie McBride is proposing us to go backwards and wants the mask mandate back on our kids for literally 6 school days. If approved, that would be tomorrow and after break January 3rd through January 7th until the optional plan takes effect. This is absolutely ridiculous, and this would even be considered. It's not fair to confuse our younger children, especially special needs, routine children, just for 6 days. Parents that wanted their children vaccinated, once the age groups were approved, they were quick to get their kids appointments to get them vaccinated. It's a parent's choice to vaccinate or not vaccinate their children, and a school has no business basing that off of a policy. Gateway isn't concerned about my kids' other vaccines or flu shots, so why COVID vaccines? That's my business, not anyone here. The optional plan has been going very well for the past week and a half, and I refuse to mask my kids for 6 school days and confuse them. The numbers in our district have remained low since the mandate was lifted. Last week, there was 4 cases, and as of today, there was 2. As a parent, I've had enough. I'm tired of back and forth. It's time to leave it in the hands of the parents like it should have been all along. I am also requesting that all masking signs be removed from our schools or the verbiage be changed to optional. There are still signs up in all of the schools. Cleveland Stewart has the mask required signs on the main door, as well as University Park. University Parks is in their lobby next to their Christmas tree, and the sign reads, "Thank you for wearing a mask." There should not be signs pushing kids to wear masks since they are now considered optional. It's like they're getting rewarded for wearing a mask at school. The first day my children were allowed to be unmasked, they still wore them all day because they saw signs getting off the bus. My son didn't want to get in trouble, so he wore his mask all day, and so did his little brother. When they came home, I had to reassure them that it was okay to take off their masks once they get off the bus. Please continue the mask optional policy as it has been working out. There are more kids masked in school than unmasked, and that is okay. Parents, let us continue, or please let us parents continue to decide what is best for our own children. And I think you guys should be calling some special school board meetings to discuss bullying and the fights that are going on at Gateway Middle School, because I have a daughter there, and it's the stories that she comes home and says are absolutely ridiculous. I think that needs to be handled too. Thank you.
Thank you, Ms. Delancey.
There it is.
Are we?
Yes, we do have the exhibit up. Dr. Chaky, if you can review that.
Yeah, the updated plan that's up for,
The updated plan that's up for approval tonight specifically looks at the mask mandate and whether or not we're going to shift towards a mask optional approach to the school. When you take a look at it, it specifically states the wearing of face covering will be optional, absent any legal mandates from the Pennsylvania Department of Health, the state, or federal government regarding the use of face coverings for students, employees, and visitors. In the event that COVID-19 cases reach a substantially high level of community transmission, a building-specific mask mandate may be instituted at the discretion of the superintendent and central administration. Also included in this is the fact that the federal mandate requiring face coverings on all public transportation remains in effect, and that includes school buses. When we take a look at some of this data, when we look at the dashboards, most recent data for Gateway School District, we provide a 7-day snapshot like we have from the beginning of the pandemic. Last year, we sort of, well, we sent out the letters that came out every Friday, just given the total numbers. Now we have that tracker. Currently, within our buildings, Gateway High School, we have 5 total cases, and Ramsey Elementary, we have 1. Now, that's what was reported. We have to rely on cases that are reported to us, and we want to reflect that for the public. When you also look at the baseline data for the county, looking at just Gateway School District, taking into account Monroeville and Pitcairn, there are 7 cases currently in Pitcairn, and also 71 active current cases in Monroeville. So this is all the information that will ultimately guide us as if we do go to a mask optional approach, we'll look at this to decide whether or not it's appropriate to require masks in specific buildings.
Okay. Thank you, sir.
Thank you, Dr. Chaky.
okay, so I'm going to read the resolution. Resolved that the Gateway Board of School Directors approves and authorizes as appropriate the following items 1 and 2 as listed in section G, resolutions presented by board members at today's special board meeting. Any section, clause, provision, or portion of this resolution for section G shall be held invalid or unconstitutional by the court or of competent jurisdiction. Such decision shall not affect any other section, clause, provision, or portion of this resolution, so long as it remains legally enforceable, minus the invalid portion. So now we have the 2 parts. Here's part 1. The health and safety plan is presented by Ms. McBride. The Gateway School District will return to the original health and safety plan that was adopted on August 17th, 2021, effective Monday, December 20th, 2021, through Friday, January 7th, 2022. Specifically, the plan states that face coverings must be worn by all students, employees, and visitors while indoors at all times. Beginning January 10th, 2022, the Gateway School District will move to a mask optional protocol. Now, this is the second one. This is by the administration.
Essentially,
go ahead.
I'm just confused. Do we need a motion to approve the administrative resolution item number 3 proposed by Mr. Chaky?
Back up.
I thought we were still on, you're confusing me. I'm sorry. I just thought we were
Essentially,
still,
we're reviewing
The
the
options.
board member resolution and the administrative resolution at this point.
okay. Thank you for clearing that up for us. We were a little confused.
So we have two motions put forth at this point.
You have two options.
Yes. Bruce, you want to
Yeah, just to-
itemize these and review them?
And just to be clear, John just spelled out
Yeah.
option 1.
Yes.
Perfectly.
Option number 2, this is the mask optional protocol. A Gateway School District will institute a mask optional protocol. The wearing of face coverings will be optional, absent any legal mandates from the Pennsylvania Department of Health, state, or federal government regarding the use of face coverings for students, employees, and visitors. In the event that COVID-19 cases reach a substantially high level of community transmission, a building-specific mask mandate may be instituted at the discretion of the superintendent and central administration. The federal mandate requiring face coverings on all public transportation remains in effect. The federal mandate includes all Gateway School District school buses and vans.
Okay, so for purposes of simplicity, the first resolution or the first number 1 really puts off the masking
Optional.
protocols and options until January 10th. Option number 2 institutes this program immediately. So that if you elect number 2, the masking optional protocol will be put into place in accordance with what John just read. Otherwise, the first one, you're going to wait till January 10th. That's the difference between the two.
Okay, motion to approve section G, item 2, mask optional protocol.
That's effective immediately.
That option has been motion made by Ms. Sarucci. Is there a second?
Second.
Seconded by John.
Manville.
I can't believe there'd be any more questions on this, but does anyone here on the board have any more questions about this option
Or discussion.
or discussion?
Okay,
Option 2, yes, ma'am.
okay, so I'm clear.
Yep.
Ms. Wushi just said that
I made a motion for number 2.
we had.
Mask optional to begin immediately.
That's the distinction between 1 and 2.
One was supposed to be presented last week to give
Correct.
people an option to get the vaccine.
Mhm.
At this point, Brittany, in my opinion, is correct. It would either have to go optional or further than January 10th for the initial reasoning behind it. Because we have been 2 weeks in without masks. The numbers still are remaining, but and they will be at school for 4 or 5 days at that point. So just to be clear, there was a reason behind this a week ago,
Right.
because there are some problems with people getting appointments and stuff. It's not that easy, but the 5 days at this point.
Can I ask also, is it, and may not be always the case, you would probably know, Dr. Short, after a holiday and the kids have been away and been with family, relative, whoever, does it tend that the rates or the
At the rate, the incidence of positive tests.
Of positive testing, they tend to go up after
Yeah,
the holiday.
it's something
So
that
we're about to go on the Christmas break. That's a concern.
we will definitely be watching, as I'm sure, with everyone tuning into the local news outlets and what's happening regionally here, not only in Allegheny County, but in Pennsylvania and nationally. We have the Omicron variant that's making its way quickly into the area. And it's something that I think is affecting a lot of different areas. You've seen a number of different athletic sports organizations shut down periodically. So yes, we're going to be actively watching it as our kids come back.
So they'll come back on the 3rd and
Yes. Now,
the 10th.
keep in mind that we are still very active within our schools during the time that we are off for the holiday break. We have a lot of athletic teams participating. So we are constantly monitoring this. And of course, with this resolution, it does provide guidance for the administration to impose mask upon a certain building and or the district if we need to, if those cases reach a substantial level.
What is that level? Do you guys have a number?
I think it's 8 to 10%, isn't
We
it?
have a substantial definition.
Yeah, it's outlined within the plan. It's basically 10% of the building. So for example, a school like Mossad that has 1,000 students, 8 to 10% are tested positive, then we would go back to some type of mask mandate.
And we're constantly looking at this.
What about situations when students might be traveling to another district and they do have a mask mandate? What is the protocol for that?
If they would go into another district, they would be required to wear that mask if that is that district's health and safety plan mandate. Yes.
I'm just going to bring up also, Mrs. Delaney asked about, the Christmas break. We just came through Thanksgiving where everybody was thinking we're going to have the major outbreak. And we had a safety meeting yesterday and you just mentioned 5. Mrs. Bishop had said we have 4 and it's doing very well. Allegheny County is the lowest with the numbers. And, I'm just going to say, going into the schools, the kids are still wearing them. They have the option to wear them if they want. They have the option not to wear them.
We're seeing a high percentage of kids wearing masks.
Right.
Yeah.
And the teachers the same way. So, I mean, we're all waiting for that big increase from Thanksgiving, which should have been here by now, but we haven't seen it, knock on wood. But like I'm saying, the kids, leave it to the parents. That's my thoughts.
May I make a comment?
Yes, ma'am, of course.
I just want to say to the public mostly that we understand that the issue is very divided among people, masks and unmasks. And I think that the compromise that we want you to be aware of that Dr. Short came up with was adding that if we do have a rise in cases in any of our schools, that we're going to go back to the mask mandate. That is the attempt to try to bring these two groups together, to give a chance to let those who are in favor of optional masking to do so, while those who want to wear a mask certainly can, as well as saying we're going to put a little safety net and try this out. If we see a spike and that substantial rate, that percentage is what the CDC uses or what the state uses when they determine the county levels. That's where they got those numbers, is to just apply that to our buildings, because we know that our kids are going to have a lower rate than seniors and adults. But you can be rest assured that if we see a spike, we're not going to ignore it. It's almost like a trial. It's a compromise. And I just wanted to point that out because initially when we talked about going to optional, we didn't have that in there.
No.
So, I mean, this board is trying to make everybody happy, which is very difficult to do, we realize, but it's not, we don't want it to be one side versus the other. And we don't want to have these battles. We're trying to move forward, get our kids back to a sense of normalcy, but not, create division or still try to give safety nets for people that are uncomfortable. That's the best I could word it.
Thank you, Mrs. Cerucci. And one of the things that is important to know is with this Omicron variant coming through, it is something that could spread more rapidly than the other variants. And this would allow, if there would be an outbreak, for the administration to act quickly, get the information out, communicate to our families, while also informing our board that, okay, here are the cases which we update weekly on our Gateway website. So it is something that we take very seriously. Compromise is a very good word that we've talked about collectively as a board here. And we're hopeful that as we come back from the holiday break, things will subside, not only in the county, state, but also nationally as well. So.
May I ask Dr. Short, if we put it in administrative hands, then if a mandate is needed, it would happen much quicker
Then gathering a board, revising the health and safety plan, absolutely.
So this would be
Yes.
an additional safety net to bringing us back and giving everybody.
But also the language does include if there is a federal or state mandate that comes back with masks, that we're automatically adhering to it.
Could you explain to our parents what would happen if there is a student, before you guys had put up a graph where you showed if someone was masked, if someone wasn't masked, if they were exposed, and
Mhm.
how the school would respond as far as quarantine?
Dr. Chaky, are you able to? I don't know if we have that chart available,
If
but
Mike goes there, maybe, Micah, can you put up the guidance, the quarantine guidance flow chart from the website?
Sure.
yeah, if you go right to the website and resources for COVID. Right there. You want to review this, Dr. Chaky?
And Kathy Bishop has done an excellent job in going through a lot of this work. I mean, she has done a tremendous job, her and the other nurses within our district, because it becomes a complicated situation to go through whenever we have a student that, or a staff member that tests positive. If you look on the student side, it first asks, are you vaccinated? Just yes, then it goes right to, do you have symptoms? And it goes down to say no, then, but when it gets a little bit complicated is when you do factor in wearing or not wearing of the mask. If you're less than 3 feet, quarantine for 10 days. If you don't have a mask, that bottom box right there in blue, you scroll down a little bit more, Micah, that second box there kind of outlines exactly how it does become a little more complicated. As it states, person is considered a close contact, 6 feet, infected person for 15 consecutive minutes or more in an indoor setting with or without a mask. The only exception is in a K-12 indoor classroom setting. Now, with the exception, it states that if both students, both the infected student and the other students around that are deemed close contacts have on masks, then they don't have to quarantine.
Notice that says consistently wore well-fitting masks the entire time.
That's the asterisk.
I'm sorry to laugh, but
No, it's
we
sometimes
know
when
our
you
kids
see
aren't doing that.
kids, you'll see this, you'll see that, and then teachers constantly remind them.
That's pretty subjective right there.
It
I
is.
think.
What is the quarantine period if you're vaccinated? I'm sorry.
If you're vaccinated, the quarantine period stays the same if you have symptoms. So it would be the 10 days. If you're vaccinated though, and you don't have symptoms, then you're not required to vaccinate or to quarantine.
So I'd just like to add one thing. I've gone into the school both before optional and after optional. And I can't say for certain, but I'm willing to wager that the vast majority of kids who had the mask under their chin, under their nose, are now not wearing it. Kids who are comfortable with the mask are wearing one or two, if that works for them. I don't think the actual effective numbers change dramatically. And that's just, I'll admit a small snapshot, but I think it's a reasonable one. So,
So
Okay.
Dr. Stark, I have a question.
yes, sir.
So it wasn't clear to me, what is your testing protocol? Who gets tested and how often among the students?
We do not test students.
Okay.
We do not require that. Testing is done by the individual family and also the individual staff member.
So then it's the data which you report, how many positives you have is based on the voluntary reporting,
Reporting, self-reporting.
self-reporting, which is basically voluntary.
Yes.
So,
And that's done throughout the Commonwealth of Pennsylvania with K-12 public schools.
okay. So I think that even if it is done throughout the Pennsylvania Commonwealth, I think that puts data on weak side.
Mhm.
As long as it's optional, then there is some bias in there.
Isn't that like that across the whole state and the whole country? We don't have mandated COVID testing in the United States. Unless maybe
Force people to
universities
test,
do,
is it?
but
Many places there is,
Well, don't say that out loud.
many
he said many places there's
There is a-
mandated testing.
testing, we get to know how many,
I would just argue that our data is subject to mandate self-reporting, not mandates other than here and there. So I think if you apply the case rates in our school, it's going to be the same as the case rates that you're getting throughout the country. Unless we're going to be having the police come to our house weekly and mandate all of us do testing. I don't know how you would get that. You know what I'm saying?
No, I mean, there are various ways of getting it. It's the police coming to the house is the last thing which will happen. But if there is a random testing, say 1 out of 10 students volunteer to get tested, I think that provides scientifically more solid data. So if we know out of 1 of the 10 tested, what kind of ratios we get, then we just have voluntary reporting. There is a difference.
Well, I do think it's worth noting, Dr. Singh, that our health and safety plan strongly recommends that parents monitor the temperature of their children.
Keep them home if they are having any symptoms.
And obviously that's not a perfect marker, but it's a very useful marker. And we can certainly remind parents of that. But beyond that, I don't know that.
So do we have a temperature check for the students when they come in?
No, we do not.
Because many nursing homes and all that, when you go visit, every visitor has to have a temperature check.
Let's do this. Let's set that aside for a moment because we've got a motion on the floor. So we'll deal with this motion, and as part of our health and safety plan update or our safety committee, we want to discuss that. Then we could do that at any time.
Can I ask one more question?
You could ask 10 more questions.
If it's COVID symptom related, are the absences,
That would be marked as an excused absence.
excused? Thank
Yes,
you.
Yep.
I literally went blank. So, okay.
Excused
So
absence.
those
Yes.
don't count toward.
No, because,
Medically excused
absolutely.
absence.
Mhm.
Even with the self-report.
Yes,
Okay.
But they're counted into the numbers that,
absolutely. Mhm.
okay.
Jack, just to validate that we had a first and a second. Bonnie, could you repeat who made the first and second for option 2, please?
The motion was made by Mrs. Cerucci and it was seconded by Mr. Ritter.
Good here.
Yes, no more comments, no more questions. Could we have a roll call, please?
Can you,
Oh,
before
there
we
is one.
do, what are we voting on?
Making masks optional
Number
Just
2.
making sure.
immediately.
All right.
Ms. Mungo, Yes. Dr. Singh,
I will not vote.
No?
I will not, no, I
You're
abstain.
abstaining?
Yes.
Okay. Mr. Ritter,
Aye.
Mrs. Warning,
Aye.
Mr. Williams,
Aye.
Mr. Bova,
Aye.
Mrs. Cerucci,
Aye.
Mrs. Delaney,
No,
Mrs. McBride.
Aye.
Motion carries.
Motion carries. Gateway will be mask optional for this moment to going forward as per the restrictions and other guidelines presented.
We will take the information that was voted on tonight, update the website with the COVID resources, and continue moving forward, and also send out information about this action to our families tomorrow.
So that closes section G. Do we have any further comments from residents? Yes, ma'am. Let's start with Ms. Beagle.
Just like to remind parents, my daughter had a 10-day quarantine between Thanksgiving and the 1st of December because somebody sent their child to school while awaiting results and got positive results. Do not send your kid to school if you're waiting for results. Please do the rest of us the kindness of not having to have our child quarantined because you couldn't keep your kid home.
And we will make a note of that and get that out to folks too. Thank you, Ms. Beagle. What's his? No.
Yeah.
What's that?
All I want to say is,
State your name.
pull the mic down. Mr. Bird and Mr. Short, we can hear you when you speak. But the rest of the school board members, we cannot hear what you're saying. We need to hear.
Well, we will make an effort to get the microphones closer, and we'll also make an effort to have our meetings back in the boardroom where acoustics are
better.
more amenable to this process. Thank you, ma'am. Anyone else? Oh, you're welcome. I hear a motion to adjourn.
Motion to adjourn?
Second.
Motion made and second. All in favor, say aye.
Aye.
Opposed? Thank you, everyone. Have a great holiday, a great Christmas. Be careful, be happy, be kind.